Thank you, Andy, and thank you, members of the media, for joining us this afternoon. To start off with some numbers like we usually do. As of this morning, Northern Light Health is taking care of 38 individuals who are positive for COVID-19 as inpatients across our health system. We have 1 at A.R. Gould Hospital, 1 at Blue Hill Hospital, 19 at Eastern Maine Medical Center, 3 at Inland Hospital, 1 at Maine Coast Hospital, 2 at Mayo Hospital, 2 at Mercy Hospital, and 3 at Sebasticook Valley Hospital. In addition, we are caring for 7 patients in their homes through our home care and hospice agency who are positive for COVID-19. Our 2-week positivity case rate is 9.8%, and our 1 week is now at 9.01%. And remember, that's the total number of positive cases divided by the total number of tests run by Northern Light Health Lab. As this data indicates, COVID hospitalization rates and positivity rates in areas served by Northern Light Health are starting to trend downward. This, however, does not mean that we should let our guard down as we are approaching the winter months and people tend to spend more time indoors. Our positivity rate still remains high, meaning there is community spread of the virus. Please remember to be vigilant and practice physical distancing, hand hygiene, and wear a mask indoors in public if you are in an area of substantial or high transmission, which currently is the entire state of Maine. As of yesterday, our employee vaccination rate, including those who received medical exemptions, stood at 94.2%. Please note that the deadline to enforce the state vaccination mandate for healthcare workers is October 29th. We continue to provide convenient access to vaccines for our healthcare team and work with our employees to get vaccinated during work time if that's most convenient. We remain focused on education and information sharing and on making vaccination as easy as possible. We continue to share our COVID-19 hospitalization graphic with the public that details the number of people hospitalized with COVID-19 who are vaccinated and unvaccinated. The data continues to show that those who are unvaccinated have higher rates of severe illness and death than those who are vaccinated. We have included a link to the data in the chat window if you would like to review it. As a reminder, these numbers represent a snapshot in time, and ICU capacity in particular can fluctuate very quickly. This data is from 12:01 a.m. this morning. The most important step that Mainers can take to reduce the impact of COVID-19 is to get vaccinated against COVID-19. If you have not completed the 2-shot series for Pfizer or Moderna or received the Johnson & Johnson vaccine, now is a great time to do so. Booster shots are also currently available to Pfizer vaccine recipients who meet certain criteria. Those who qualify include older Mainers, people with certain pre-existing medical conditions, and people who are at increased risk of exposure. If you think that you may qualify, please visit our website for more information. The site includes a list of vaccination sites and instructions on how to make an appointment. It is also time for influenza vaccines. If you are receiving a booster or your primary series for the COVID vaccine, you can get your flu shot at the same time. We are again urging people to be vaccinated against the flu as well as COVID, as influenza can also be a costly and deadly disease. COVID-19 and influenza are both respiratory diseases with similar symptoms, including cough, runny nose, sore throat, fever, headache, and fatigue. COVID-19 and influenza spread in similar ways by droplets and aerosol when an infected person coughs, sneezes, speaks, sings, or breathes. The same groups have higher risk for severe illness from COVID-19 and influenza, including older adults and people of any age with chronic medical conditions. The same protective measures are effective against COVID-19 and influenza, including hand hygiene, physical distancing of 6 feet or more, and mask wearing while indoors. What it is important to note is that the treatment are different for COVID-19 and influenza, and this is why it is important to get tested if you have symptoms. Antiviral drugs for influenza can reduce severe complications and death, and they are especially important for high-risk groups. Monoclonal antibodies can help reduce hospitalizations in individuals with mild to moderate COVID symptoms. Vaccines developed for COVID-19 do not protect against influenza, and similarly, the flu shot does not protect against COVID-19. Please contact your medical provider if you have any of the following severe symptoms of either COVID-19 or influenza, such as shortness of breath, inability to keep fluids down, confusion, persistent pain or pressure in the chest, or a high temperature such as a fever over 100.4. And with that, I'll turn it back to Andy and we can start our questions.
We'll start today with WADI. Allegra, you should be able to unmute now.
Great. Thank you, Dr. Jarvis. My first question is, the BDN had an article this morning just talking about the general mistrust of the vaccines in some of the more rural areas in Maine. What are some steps that you guys have considered taking moving forward to try and reach those people in those areas?
Well, we continue to do as much outreach as we can. Obviously, we have things like these media briefings. We also post on our Facebook page and other social outlets in order to try to reach out to people. And we continue to encourage people to reach out to a trusted professional who has accurate and complete information. That typically is people's primary care provider, and we certainly encourage that to happen, not just for Northern Light Health, but for all of our primary care providers across the state. For myself, I've certainly met one-on-one, both with patients and with staff who have concerns. And most of the concerns are really around fear of the unknown. And so really what we need to do is continue to focus in on that these vaccines are heavily tested, probably some of the most tested medical agents that we have ever had in the history of time. We have had now well over several 100 million people who have been vaccinated against COVID-19 with very limited bad effects from that. And so that's the thing that needs to be clear. These are incredibly safe vaccines. They're also incredibly effective. So even those individuals who received their primary series as much as 8 months ago, we know that the vaccine efficacy of preventing hospitalization, severe disease, and death remains exceedingly high. The reason for the booster shots is really for those people in those subcategories who may either be compromised from an immune system standpoint or maybe a greater exposure, like those who work in healthcare, those who are first responders, and certain other agencies where they come in contact with the public on a regular basis. These vaccines are safe and effective, and that's really the message that we have to continue to reach out to. But having those one-on-one conversations to ask what it is that their specific concern is often is what gets us to people getting vaccinated. So thank you for that question, Allegra.
Great. And then my next question is more related to non-life-threatening visits to the emergency room. What is that looking like right now in some of your hospitals, and what impact is COVID playing on sort of those wait times and what that could look like for the general public?
Yeah, so I don't have specifics on that, but I can tell you that, yes, our emergency departments across the state of Maine, not just at Northern Light Health, are extremely busy right now, and it's multifactorial. Some of it is due to COVID, but as I just said, our COVID numbers for hospitalizations are coming down, but we still have individuals who are presenting to our emergency departments in walk-in care and urgent care for symptoms of COVID. We do expect that will also start to have an impact when flu season starts, that they too will. But we've seen just a significant increase in overall need for healthcare of late. And that typically happens to us in the later months of the summer and certainly sometimes in the fall. And so that's really what we're seeing is just our overall demand has increased and that taxes our system. So what that means is the way you need to do things to protect yourself, to prevent your needs to coming to our emergency departments or our hospitals or walk-in care or even our doctor's offices. And again, it's those same basic things that we've talked about. Protect yourself against respiratory viruses, particularly COVID-19 and influenza. Get vaccinated, wear your mask, wash your hands, stay physically distant, stay home when you're ill. Thanks, Allegra.
Okay. Next up we have Kevin Miller, Portland Press Herald. Kevin, you should be able to unmute now.
Great. Thank you very much. So, Dr. Jarvis, thanks for posting the most up-to-date information on your hospitalizations. One question about the vaccinated folks that are in there, that are in the hospital or in the ICU. Generally speaking, and I know it's going to vary from day to day and by patients, but generally speaking, are the vaccinated people that end up in the hospital or in the ICU, are most of them older? Can you speak about kind of the demographics of them? Do most of them have underlying health conditions that, that's a big reason for why they are in such severe condition?
Yeah, while that's not universally the case, most of the individuals who are vaccinated who have needed hospitalization, and especially those who have needed critical care, have had some underlying medical condition. We are actually working on building a database so that maybe we can share that information more readily to the public, but that takes a little bit of time for us to do. Again, it's not 100% that's what it's at for the people who are vaccinated. But most of them have a pre-existing medical condition. What I can say is that when we look at our unvaccinated population, they are becoming a younger, healthier crowd of individuals who are requiring hospitalization, and that's been the case for the last few months.
Great.
Okay, go ahead. Sorry, Kevin.
Yeah, no, secondary question on booster shots. Just what kind of demand are you seeing from people at your facilities for booster shots, and are you expecting that to continue to go up
Yeah, so we expect that to continue to go up. Obviously, as time goes by, we have more people that are eligible just from a time standpoint. We have been giving out booster shots in our primary care offices, as well as some isolated clinics dedicated to vaccination processes. In addition, of course, we've been vaccinating healthcare workers. There has certainly been a strong interest in those vaccines. We're working again to collect more data to be able to present exactly what those percentages look like.
All right, thanks, Kevin, for your questions. Next up, we have Jennifer Mitchell, Maine Public. You should be able to unmute, Jen.
Hi, so can you just give us a quick update on how the staff vaccination process is going and the staff issues, and if there are any, what's compliance like as, time is ticking down to the actual enforcement period of that, and also if there are any other new recruitment efforts, I guess, to try to maybe fill some of those positions if people have left. Just an update on that.
So again, not my area of expertise, but I will say that we continue our efforts like we always do. Healthcare staffing is always an issue here in the state of Maine, and so we continue those efforts as we always would have. As far as our vaccination efforts for our employees, we are now over 94% of employees across Northern Light Health are now either vaccinated or have a medical exemption, and so that's an exceedingly high number. And so and we continue then to focus in on those who have yet to make a decision as to whether they are going to get vaccinated or not, or whether they are going to leave the organization due to the mandate or not. And so we continue to have those one-on-one conversations with individuals. And as I said before, for the general public, we treat our staff the exact same way. It's what is your concern? What are your fears? What is it that we can answer for you to help you to make the decision that's right for you? And so we continue to do those efforts. So thank you for that.
And just a follow-up to that, what are the fears? Is there an overarching theme of concern that's there, or is it just everybody has an individual, concern? Because time is obviously running out on, them getting the doses.
Yeah, so I think, again, everybody has their own individual reasons, and we try to support each and every one of those. But the biggest thing that I hear when I meet one-on-one with individuals is concerns about long-term effects of vaccines. These vaccines were only started being given out last December, and so fear of long-term. But the fact of the matter is, some of these vaccines were given out well over a year ago in the original study groups, and those people continue to be monitored. In fact, that's the group that we look at to see whether or not the vaccine efficacy wanes over time. And so we do have a long period of time. The thing to remember is that vaccines, when we talk about long-term side effects of vaccines, they tend to occur within the first 8 weeks of somebody getting the vaccine administered. 8 weeks is not a long time. And so when we talk about long-term effects for vaccines, we've already passed not just that 8-week mark, but we've now passed the 8-month mark and the 1-year mark for some individuals. So we have pretty good data to say this is not going to be a long-term issue and a long-term problem. These vaccines are safe. And again, we have history on our side to know that, because we've been using vaccines now for well over 100 years. And so we know when vaccines typically cause issues. And again, that's within that first 8 weeks, certainly not 12 months later. So that's the safety issue. The other concern I hear continues to be those concerns about fertility or pregnancy issues. And we have not seen any issues in terms of fertility or problems with pregnancy. In fact, the CDC just last week issued a dire warning that women who are pregnant should get vaccinated against COVID-19 because they are extremely susceptible to severe disease due to their pregnancy. And that affects not only them, but their unborn baby as well. And so the vaccine helps protect both mom and baby. What we also know now is that mom actually produces antibodies that get transferred across the placenta into the baby, and that protects the baby when the baby was born. We've always known that those antibodies have gone and that the baby received those antibodies, but now there is strong evidence that those antibodies actually protect the baby. And obviously, newborn babies cannot be vaccinated against COVID-19, so it's actually a beneficial thing for both mom and baby, as well as her family, the community, and everybody else. So thank you for the opportunity to remind people of that.
Thanks, Jennifer. Next up, we have Ellsworth American. Anne, go ahead and ask your question, Anne.
Thanks for taking my question, Dr. Jarvis. I'm just wondering if there's any updates on information when the vaccine will be available for 12 and under.
Yeah, and another excellent question. As we've talked about before, Pfizer has submitted their data to lower the age beyond age 12 for their particular vaccine. We do know that the Advisory Committee on Immunization Practices, a subdivision of the CDC, will be meeting this month to discuss that specific topic. In fact, they right now have 3 scheduled meetings, one to talk about whether or not Moderna should be authorized for booster shots, whether or not we should mix and match vaccines. So if you initially received Moderna, could you receive Pfizer? Right now, that is not the recommendation. And then lastly, to look at the efficacy and the safety data for the Pfizer vaccine for individuals 5 to 12 years old. So we do expect that we will hear some significant information on or around Halloween. Whether or not that will say that it gives us the go-ahead to administer vaccines to those under the age of 12 still remains to be seen, but we are hopeful of that. And I will tell you that Northern Light Health and its partners across the state and the Maine CDC are working right now behind the scenes to make sure that we are prepared if and when we will be given the go-ahead to vaccinate children. And we hope that will come soon. I will also say that the School Nurses Association across the state of Maine has done a wonderful job of already mapping out where it would be important for them to run school-based clinics. And so all of those things are happening behind the scenes. And I'm hopeful that we'll be able to give you some great news sometime around Halloween about being able to vaccinate children. So thank you.
Thank you. I have no other question.
Well, thank you.
Next up, we have Fox ABC Maine, Brooke Riley. And Brooke, you had mentioned that you're on your phone. So I'm going to try to unmute your phone, and hopefully that will work. Brooke, are you there?
Can you hear me all right?
Yes, we can.
Hello?
Yep, we can hear you.
Okay, perfect. So my question is, what are your thoughts on e-cigarette use during the pandemic? Have you guys seen an uptick in cases because of this, or any outbreaks per se?
Yeah, so the question was, have we seen any uptake or increase in problems due to e-cigarettes during the pandemic? And I really don't have any particular knowledge of that. And that's certainly not something that I've been working on in particular. We can explore our offices and see if we can get some information back to you, but that's not something that I'm aware of.
Okay, yeah, no worries. And then the other question was kind of based off of the last question about kids' vaccinations. What is your guys' plan once that is approved, if it is?
So right now, of course, our primary care practices are already administering Pfizer vaccine, including our pediatric practices, because they do have individuals who are 12 and older who would meet the requirement for vaccination at this point. So we're already doing that. It's just a matter of extending that out. In addition, we will work with the Maine CDC and with our partners across the state, including school nursings, to deliver vaccine in schools if there is a need for that, as well as open up other additional clinic slots like we have for booster clinics as need be. So that's what our plans are right now, and we continue to work on that. But like I said, we are already doing this. We're just doing it for a different population, and we can continue that for our pediatric population as well.
Great, thank you so much.
You're very welcome.
All right, let's go to your questions. Next up is News Center Maine. I have their questions, Dr. Jarvis. I can read them to you. The first is data for all significant indicators is trending downward. Do you think it will continue in this direction, like most of the rest of the U.S., or is it a plateau with the danger of reversing course?
Yes, that's an excellent question. As you guys have pointed out many times, my prognostication skills are not always the best. I had predicted that we would have this large spike that we currently have. I predicted it would happen in the fall, and obviously it happened more during the summer months. But I do see some encouraging news looking at the rest of the country. And as we talked about before, Maine tends to lag behind the rest of the country by at least 2 weeks when it comes to respiratory illnesses. And so we have seen some of those great hotspots, particularly in the southern part of the country, have started to abate. And so my hope is that we're seeing the same thing here. But we do know that there are areas of Maine where that is not the case. We know that in western Maine, we continue to have large numbers of individuals who not only have COVID-19 but are requiring hospitalization, and so there is still more work for us to do. While it does look a bit brighter today than last week when I gave a media briefing, it's still a word of caution. I mean, we're talking about a positivity rate above 9%, so that means nearly 1 out of every 10 tests that we run is positive for COVID-19. So there's still a tremendous amount of community spread out there. So while it does look better, I still have a word of caution: wear your mask, wash your hands. Stay socially distant, stay home when you're ill, and if you're not yet vaccinated, please, please, please get vaccinated.
Right, and I have a second question for them. This is a bit of a multi-part question. You've touched on some of this already. Is there any particular department or role within the hospital system that is showing the most resistance to vaccination? And do you have any detail about where we're at with vaccine mandate compliance, issues raised by those not in compliance, how many people are expected to lose their employment?
Yes, I don't have any specifics on those. I can tell you that particularly our providers, and particularly in that group, our physicians and our nurses are running very high as far as vaccination rates. 95% or more of them are vaccinated already. So those that are the most knowledgeable and the most in contact with our patients are vaccinated. I don't have any of the other details. That's typically something that I ask Paul Boland to answer a question for. As far as, do we have any consideration right now as to how many people ultimately will leave? We do not. Like I said, it is our endeavor to keep every healthcare worker that we have employed. We want them to stay here. We want them to continue to serve Maine, and we will continue to work with them until the time that the mandate or the enforcement of the mandate occurs, in trying to encourage them to get vaccinated so they can stay doing the care and the needs that we need here in the state of Maine.
Thank you. Next we have WERU, Amy Brown. You should be able to unmute now.
Yes, thank you. And thank you, Dr. Jarvis. I have a couple of questions about the medical exemptions. How does one qualify? Are there a specific list of qualifying illnesses, or is it, because we had a listener specifically ask about Lyme disease, or is it up to the individual's primary care provider to make a recommendation? How does that process work?
Yeah, it is up to the relationship between the individual and their practitioner to determine whether or not they have a qualifying exemption, and that's really what it comes down to. We do review those as a matter of course, but it really comes down to that individual. And for most people, again, these vaccines are incredibly safe, and because of the fact that there are 3 separate vaccines, the typical reasons why somebody could not receive a vaccine is due to allergic reactions. But because there are 3 separate vaccines, it is highly unlikely for somebody to be allergic to all 3 of those. And then there are some very unique conditions that might qualify for a medical exemption. And so again, it really is that individual discussion that has to happen between the individual and their provider.
Okay, my other question about that is, we've had people ask about different professions, but I think in the medical profession it has different nuances about whether or not a consumer or a patient has a right to know if the person that they are working with has been vaccinated or has an exemption. Is there any way that people will be able to say, I'd rather not work with someone who hasn't been vaccinated, and be directed to another provider within the organization?
So just like we have to protect the privacy of our patients, we have to protect the privacy of our staff. So those are some kind of nuances that are being worked out. One, because we have some legal challenges to that, and we need to make sure that we are abiding both by the mandate and by employment law. And those are definitely things that fall outside of my expertise. And so that's really the only comment I can make on that.
Great, thank you.
Yeah, it looks like we made it through our list, so we'll end there for today. Thank you all for attending today and helping us get out all of this important information. As I noted before, we'll have the high-quality video file, the briefing, available this afternoon. Just let us know if you'd like it either in the chat or send us an email afterward. We'll get it to you as soon as it's ready. So with that, we'll wrap up for today. Any final word, Dr. Jarvis?
Yeah, just once again, we are very concerned about the upcoming flu season. Typically what we see in a year is that, we have a very mild flu season one year, people let their guard down, and then we have a bounce back year after that. We cannot afford for that to happen. So please get vaccinated against both COVID-19 and influenza and do all of those good protective measures. We do not want to see an increase in respiratory viruses. We want to be able to take care of all the other needs of our communities. Thank you again for joining us this afternoon and getting our message out. We really appreciate it.